I did a podcast on universal facelift incision techniques to make them very hard to see. If you are listening to this podcast, I'm not going to repeat those principles, so I encourage you to listen to that podcast. However, I want to talk specifically about ideas and principles and variations that affect the male patient who's undergoing a face or neck lift. So the incision we'll start with under the chin is in a hair-bearing area. There is always a risk of hair loss around the incision. Usually it's not like a patch of hair loss, but there could be a very fine line. I work really hard not to transect those follicles, not to cauterize them or injure them. But that's something that someone needs to know, is there's a risk of some hair loss along that incision line. If someone's wearing a super short beard, there's a chance you could see a line if someone's actually looking underneath their chin. It's not that common, but it's something someone needs to know as a possible risk. The second thing to understand is, how do I place incisions for men differently from women? So the standard retrotragal incision, which is the incision that goes inside the tragus, the tragus being the piece of cartilage that sits in front of the ear canal to hide it, I do in, I would say, 70% of men. And about 30% of men, I go in front of it, just in the little dip that sits in front of it, called a pretragal incision. And then rarely I'll go along the actual beard line in some men as well. So let's talk about, how do I make those decisions about where the incision should be, and what you should be thinking about as a gentleman about what's involved with that incision. So, of course, the most ideal incision is one that's hidden inside the ear. That's preferable, but there are some exceptions where that won't work as well. So, first of all, if a male has, men typically have much more sebaceous, oily, thick skin. And if that male skin is super thick and sebaceous, it won't look natural on the ear. So if I look at that ear skin, that skin that's sitting right near the ear, and I know I'm going to put that skin on the ear, it won't look quite right. So in that case, I'm going to recommend for the male to consider having the incision just a few millimeters in front, where it sits in a natural crease. And if and along those lines, if a male has a really deep crease sitting in front of the ear, that really works really well to hide it. So those are some factors I look at, is skin quality. The other factor I'm looking at is, is asking a male, what do you do with beard? If the person says, I never wear a beard, and they have those skin characteristics, I will do a retrotragal incision for them. If the man says, I like to wear a beard, and I don't mind, I would like that option, then I may do a pretragal incision, but understand that the beard will be closer to the ear. If the male always wears a beard and really likes to wear a beard, then I will make the incision along the back side of the beard, because I don't want to move the beard back onto the ear or farther back. And that's something that I have to think about. Now, the risk, though, is if he shaves the beard off, if I place that incision there, that incision could be more visible in the first 6 months in particular, as that skin is beginning to heal. The other thing, too, is that if I place a pretragal or retrotragal incision, which are the standard male facelift incisions, the hair will move farther back. It will be one of two issues. One is, if it's a pretragal, in other words, incision in the depth in front of the ear, as they're shaving, they may have to shave a little closer to the ear. If it's a retrotragal, in other words, an incision inside the ear along that border, then there could be hairs that are going onto the ear. So what I do in that case is, if I see hairs there, I will depilate it. In other words, I will actively transect underneath the skin all the hair follicles to kill them so they don't grow through. But occasionally some do grow through, and you may have to either pluck them or do electrolysis or laser hair removal to finish that, if there are some there, if you don't want to shave it every day. So those are some limitations for a male. A couple other points to understand with men is, men typically actually heal very fast, sometimes even faster than women, because of the beard distribution. It does two things. One, it gives better blood supply, so that can lead to a faster healing. And the second reason for men is that the beard distribution allows it to look blurred out, any bruising or swelling or anything like that. So what I'm talking about is, men are not allowed to shave for 2 weeks after the procedure. So you should shave. I'm asking you to shave when you come in for the morning of the surgery, but don't shave for 2 weeks. So that beard starts to create this blurring effect where people look at you and they really don't feel as if you had anything done, because it causes that little distortion of the swelling or bruising to be camouflaged. One thing I tell my patients is that If you're not used to wearing a beard, or if you don't have much beard, that's fine. But if you have a beard, just to get used to wearing them on occasion so people won't suspect anything after a procedure if one day you all of a sudden start wearing a beard for 2 weeks. The other thing is important is after 2 weeks, you can shave everything. Just be careful with the incision under your chin and use an electric razor for 2 more weeks. After that, at a month, you can go return back to your normal shaving behavior. So those are some things to understand that are unique to the male patient undergoing a neck or facelift. But I wanted to talk about those things in terms of incision placement, recovery, and other issues of recovery that are not applicable for women.